I'm Professor Mike Kelly, and I'm the Director of the Centre for Public Health at NICE. So I lead on all the work about prevention, health improvement, and communicable disease. NICE is working on two strands of work this year. The first deals with non-communicable disease, things like type 2 diabetes, obesity-related problems, alcohol-related problems, smoking-related problems. And we have a strand of work which is about helping people change their behaviour in relation to these things, but also the measures that can be put in place to protect the population from the dangers of eating too much, not taking enough physical activity, and that kind of thing. The second strand of work is in communicable disease, and we're particularly interested in the prevention of the spread of tuberculosis, HIV, and hepatitis. And we have a range of guidance which is related to those things too. On the 1st of April 2013, public health in this country changed dramatically. First of all, local authorities picked up most of the commissioning responsibilities for public health, and a new organisation, an umbrella organisation, came into existence called Public Health England. Since then, NICE has been working very, very closely with both of those sections. One, on the one hand, very closely with Public Health England, and on the other, we've been visiting as many local authorities as we can around the country, partly so we can learn as much as we possibly can about the world from the local government's point of view, but also because we've got a new product called Local Government Briefings, and we wanted to know whether what we were producing was fit for purpose. Did local authorities like them? If we took them to Stockport or Wigan or Blackpool, did they make sense to the local councillors and the officers in those local authorities? Part of the joint working that we've done with Public Health England is shown in the joint launches that we've done. So back in January this year, NICE launched its behaviour change guidance. And then a few weeks later, we had a joint event with Public Health England, the Local Government Association, designed specifically for local authorities so that we could work together with them, and so local authorities could see just what opportunities the NICE behaviour change guidance offered them in terms of the big ticket items around the public health outcomes framework against which they're held accountable. The most topical sessions at the NICE conference this year relate to the two strands of work I've already mentioned. On the one hand, health improvement against the non-communicable diseases and the measures that can be taken against communicable disease. And you'll see, if you look at particularly day one of the programme, you'll see both of those things there. And there are sessions for you to choose from in terms of both the health improvement type of things and the communicable disease type of things. But also, very interestingly, we've got a session toward the end of the day which is breaking new ground in public health, or where public health is breaking new ground. And this is where we're putting together the science of genetics with the science of health inequalities. And we've got several speakers who will be picking out on those sorts of things and some of the extraordinary new developments in what are called epigenetics and how they might link to health inequalities. Well, I think it's always difficult to pick out the best people to go at a conference like this. I think all the speakers are really, really good. But I suppose if you don't know much about epigenetics, Professor Paolo Vineas from Imperial College, and Dr. Flanagan, also from Imperial College, have got some very interesting new stuff. But we've also got some great sessions relating to the role of local government. We've got a clinic on the new local government public health briefings that NICE produces, and also good sessions all round. So I don't know, I'd find it difficult to choose, and I'd try to go to everything.